Hi, everyone. Welcome back to the Mind Movement Health podcast. I'm your host, Kate Boyle, and today I have a very special guest on the show. We're going to be chatting about pelvic floor health. Courtney, welcome to the podcast.
Thank you so much for having me. I'm so excited to be here.
Well, I'm excited to have you on the show today because this is such an important topic for women at all stages of their lives. I think sometimes we think we just need to think about our pelvic floor around sort of, pregnancy or post-pregnancy, but realistically, it's something that we really do need to think about in all areas and all stages. So, can you, before we dive in, just introduce yourself to our listeners?
Of course. Well, like she mentioned, I'm Dr. Courtney. I am a pelvic floor physical therapist, living in sunny Arizona in the USA. And I found had a unique journey to get to where I'm at now. I work with everybody completely online, but I definitely didn't start this way. I was a traditional in-person physical therapist for so long. But for a while, like I wasn't able to treat people in the capacity that I wanted to, especially female athletes. I feel like women in general who are really active, they get like the short end of the stick in terms of like rehab and like return to sport kind of care, whatever kind of sport they want to do, or physical activity. And that's where my like business was kind of like bloomed out of was that bridging that gap and that need. So I love the pelvic floor. I love a lot of things that have to do with improving pelvic health in terms of like a lifestyle management and changes and healthy habits and all of these things. And so I'm excited to be here today and talk about all of those things.
Amazing. Well, I needed you like 20 years ago when I was like, in my dance era and having, overactive pelvic floor, but leakage when I was jumping and kind of just thinking that this was all normal and no one ever said anything to me and all the rest of it. So I'm glad to hear that this is now out there for women to get help with.
Yes, absolutely. And it's one of those things I feel like in today's era, everybody's talking about the pelvic floor and the core, but like 10, 20 years ago, like we still had pelvic floors, but nobody was talking about them. So it's a perfect time.
Mm, amazing. Now, let's just go straight back to the basics. And can you explain what our pelvic floor is?
Yes, of course. So our pelvic floor in general, and like the basic, simplest way to explain it is like a group of muscles that lie at the bottom of the pelvis like a hammock. Like if you think of a hammock, it's just right underneath everything. So it sits right beneath your bladder, your bowels, your uterus, like everything, and it sits right and it connects between like the pubic bone to the tailbone, one way front to back, and then side to side from your sit bone to your sit bone. So it's just this generalized like bowl of muscles that have a lot of important functions in terms of providing support to the pelvic organs, stability to the pelvic bones, sexual function, sphincteric function, helping with like continence, so bowel, bladder function. And then, of course, some another action of like sump pump. So it's like inflammation, blood flow, all of that. So in general, there's a lot of really important functions of the pelvic floor that nobody really knows about, thinks about until it becomes an issue. And then they're like, oh, wait, like I have to do something about this. And it's not always an organ issue. And I think that's the biggest misconception with like bladder issues and bowel issues is that they then go automatically to a specialist. Rightfully so, because it is organ in nature. And like people don't think about muscles when they're like, well, why is my organ doing something wrong? But for the most part, like a lot of these issues like can be, treated with conservative care by a pelvic floor specialist because the muscles control a lot of those functions and or not control like literally control the organ, but like they play a big role in like what we have, like pain or like leakage or prolapse or like all of the other random symptoms. So it's really important that people understand what they do, where they're at, and how they function.
Mm. And I think just knowing that there are specialists like you out there, there are pelvic floor specialists that you can go to because I think there's probably, I know when I was younger in my early 20s, before I'd done, all my sort of movement, Pilates training and things, I didn't even know that there were like pelvic floor specialists out there that existed. I just assumed you go to your doctor and try to work something out.
I know. And that's the thing. It's like, even when I was in school, like this wasn't really a thing. Like pelvic floor PT, like we had one lecture on it, and that was 5 years ago. Now, most PT programs have some level of like an extracurricular pelvic floor course, or you have to go with continuing education. And I think it's just becoming more and more prevalent that we're talking about it and having these conversations because like we need it. Like we truly need it. And in order to actually like heal the woman at hand, whether it's they're pregnant, they're postpartum, they're dealing with back pain, hip pain, like I say to everybody, I'm like, if anything is like dysfunctional around the pelvis, like go see a pelvic floor specialist over an orthopedic PT, especially like a orthopedic male PT. Like, come on, like they don't know as much as far as like we know as females, but also like providers like OBGYNs, urogyns, like all of those other providers, like not many of them know the function of the pelvic floor, and it's not their fault. Like they're just not trained on those things. Like an OBGYN, they're trained to deliver a baby. They're not trained to release a tight muscle in the bottom of the pelvis. So it just really depends. Like you want to go to see somebody who's going to work on that area that they are specialized in.
Mm. And I will just share one of my own personal stories after having my first daughter. I had a lot of pain post delivery and pain that wasn't disappearing. So I took myself off to my OBGYN and they were like, yep, everything's healing well. You're totally fine. I knew something was wrong with my background. I was like, no, this is not right. I went off to the osteo thinking maybe I just needed an adjustment in my pelvis and that'll settle down. Nope. So then I took myself off to the pelvic floor physio because I was like, something's not right. And when they had stitched me up from tearing post birth, they'd actually stitched up some nerves. And then I ended up having to go back into hospital and have it's called the Fenton's procedure done because of that stitch up of my pelvic floor with the nerves. So things like that happen. And even me having knowledge around the pelvic floor from having the birth to getting to that pelvic floor physio, it was a couple of months to get through all that because I had to go through the people and, explore. And I had that knowledge. So people that don't even have that knowledge, always just go get checked out. You know your
Yeah.
body, you know if it doesn't feel right. So I'm always just a big advocate just to keep, trying to find the right person. And always seeing a pelvic floor physio, I think, post having a baby is just a really great thing to do.
Yeah, it should be the norm, right? Like it's like you, especially like your first postpartum experience, and I think that's usually when is the perfect window of opportunity to like get started because like after your first birth, like what are you handed when you go home from the hospital? It's like a packet
Oh,
of like,
shit
oh, here's
paper.
some information. A piece of paper, right? Like, and yes, maybe we put a pamphlet in there that's like, go to pelvic floor PT, and like maybe you're so overwhelmed you're not even going to read the pamphlet, but hey, it's there if you want it, kind of thing. But also, after your first baby is like the perfect window of opportunity to go because you don't know. You don't know how your postpartum delivery is going to go because you've never done this before. So that's also a great time, but also because like you're gonna feel probably your best postpartum, maybe after your first compared to like your second, your third, your fourth, yada yada. And when you have that good window of opportunity where you have like the least amount of like complications, and I'm not saying not everybody walks out of birth and they're like 10 out of 10 and they like feel great. Like not everybody has that experience, but like you don't always have so many symptoms after your first birth as you might after your second or your third or your fourth. So like most women skip the opportunity to go because they feel like they don't have any issues. Because they're like, oh, it's no big deal. Like, I don't really have any pain. I don't really have any leakage. And they're just like, well, I'm healed. Let me go back to exercise. And it's like, yo, you just carried a baby for 9 months. Like, what makes you think that you are just ready to rumble again in 6 weeks? It's crazy.
Mm. But like you said, I think that's an education piece that kind of needs to come into play. Do you know what I mean? When you first find out you're pregnant, there should be, information that's given, to
Yeah.
support you for when you are
Yes,
postpartum. But there's not a whole lot of that.
absolutely. I know. It's awful.
And then the flip side is, it's someone like me who was really strong going into birth and then having a pretty terrible birth experience as far as it went. So I
Yeah.
came out of it going, oh my goodness, I want to have another baby after this. I do not want to go through that again. So what are all the things I can do now to prevent that happening second time around, if it is possible to
Yeah.
prevent?
Yeah, and I mean, yeah, it's hard to say because every birth experience is going to have its own complications and you can't ever prepare for that. However, the biggest thing, like we're mentioning, is education. What can go wrong, and how can I mitigate as many interventions as possible after those, or for those complications, kind of thing. But the biggest thing I would say is you mentioned I was really strong going into my first birth, but my postpartum or my delivery kind of messed it up or whatever, right? So the same thing goes is like going into your next birth really strong, but also relaxed. Like, let's not downplay that because everybody thinks that the pelvic floor does everything. It does everything for birth. And if we have a really strong pelvic floor, we're just going to push that damn baby out. And that's not how it works. Like, the pelvic floor needs to be able to relax because the uterus is what actually pushes the baby out. So, with that being said, like, yes, you can be really strong physically, your entire body going into birth, but we need your pelvic floor to be mobile and your hips to be mobile because that is what's going to allow things to relax and the baby's going to move down into the birth canal and have an easier way out than being really strong and tight, right? So my biggest thing too is like, are we breathing correctly? When you breathe, does your pelvic floor move? Because when you are breathing, your pelvic floor is supposed to move. So if you have always been like a chest breather your whole life and you've never used your diaphragmatic muscle before to breathe, that's probably the first place to start. Because if you can learn diaphragmatic breathing and how your breath actually moves the pelvic floor passively on its own, that's where you need to start. Your pelvic floor will start to move. Now you know what relaxation feels like. You know what lengthening feels like. Then you're able to actually maybe tap into those relaxation cues during moments of relaxation during labor. Like, for example, contraction, relaxation. Like, you're going to go through waves of intense, unbearable pain, but you also have waves of relaxation too. And that's
Mm.
when you really lean into those relaxation strategies. Birth prep, I would say, is another big one too. Like those last 4 to 6 weeks during pregnancy, like how are you preparing your body to expel a baby? And obviously, delivery and everything can change at the drop of a hat. Like you can have a C-section if at any moment, right? But if you're preparing for like a natural at-home water birth, anything like that, like you're mentally preparing for that relaxation and then you're also physically preparing. You're making sure your hips are mobile. You're making sure that the baby has room to go down into the pelvic outlet. You're also making sure that you have good breathing techniques, pushing patterns for when you want to get that baby out. So there's a lot of things that you can go into preparing. But like I said, you never really know. You never really know how it's going to go. So just like have your backup plans. But then, especially postpartum, like early postpartum, move, move your body. I think a lot of women take it too easy, and delivery complications can make it hard to, rightfully so, make it hard to like want to get up and do anything because you're in pain, you don't feel well, all of that. But I think a lot of people downplay how important blood flow is to your body and to the pelvis when you get up and move. And most people maybe abide by like the 5-5-5 rule, which is like 5 days in bed, 5 days around the bed, 5 days out or like out of the bed, and then 5 days like around the house and like whatever, the 15 days of rest and recovery. And of course abide by that for to some extent, but some people can't. Some people can't. Like they're a single mom, they have other kids. Like you can't just lay around in bed for 5 days. So if that's not your situation, then get up and move, but move gently. There's stretches, there's mobility, there's easy things for activation of the pelvic floor, the core, your breathing that can just wake things up down there and aid in recovery, aid in better blood flow, helping reduce inflammation, helping that mind to muscle connection restore. I know this is a really long drawn out answer, but I hope it's like kind of on track for what you're looking for.
Yeah, 100%. Women, we've covered so
Yeah.
much through there.
Yeah.
But, as you said, going back to that breathing piece, that is a huge part of it that I think most women aren't really aware of
Yes.
until they're kind of in the midst of the birth and realize how important their breath is. And as you said, a big part of what we do when I'm working with my clients in the sort of Pilates setting is relaxing the pelvic floor as they get closer to that birth and knowing that they know how to do that rather than focusing on really trying to engage and tighten the pelvic floor. Because when you get into that birthing suite, you really want to be able to relax into that because obviously, as we said, so that baby can make its way out the birth canal. But I want to do
Yes.
address that kind of sort of piece of the cesarean in the sense that I know a lot of women believe that if they have a cesarean, that their pelvic floor isn't really going to be affected at all by the pregnancy. So can you chat about that a bit as well?
Yes, of course. So yeah, C-section, you're not off the hook, like for sure, because you still held a baby for 9 months. And your pelvic floor is still extremely weakened because you had so much extra pressure down on the pelvic organs that also pushes pressure down on the pelvic floor. There's just more weight. And over time, gravity plays a role that it does. And that's extra pressure that weakens the pelvic floor muscles because it stretches them. And if you're not actively having good range of motion to those pelvic floor muscles, meaning you don't even know they exist, they're not contracting, they're not relaxing, you're really just weakening them. But if you're cognizant of, okay, if I'm breathing correctly when I'm exercising, I'm actually taking the time to exercise during my pregnancy, I have good range of motion to my pelvic floor. I know when it contracts, I know when it relaxes, and you're just a little bit more aware of what's happening down there, you're less likely to have as much weakness than someone who's not, right? So my biggest things are is like, yes, even if you opt for a C-section or you go into an emergency C-section, like, yes, your pelvic floor doesn't have to stretch 3 times its normal length as the woman who has a vaginal birth, but you still had the same, you're still in line with the person that had the vaginal birth for 9 months. You guys are the same people. And just because someone pushed through the vaginal canal, yes, that really does weaken them and it makes them really uncoordinated, like when you are done delivering, because they stretch so far and you have to kind of get them to come back together, reconnect that mind to muscle connection. But the C-section woman is still prone to pelvic floor dysfunction just as much as the vaginal delivery, maybe not as high, but it's still there.
Mm. And when we talk about pelvic floor dysfunction, there can be hypertonic pelvic floors and hypotonic pelvic floors. And again, I think most people just think about leakage and they don't think about sort of the flip side of that. So can you dive into those as well?
Of course. So I would say most of the population has a hypertonic, meaning overactive, tense, tight kind of pelvic floor, because a lot of women hold tension in the pelvis. That's pretty natural for us. We also deviate towards postures that allow for opportunities of like glute gripping and ab gripping and pelvic floor gripping that then contribute to overactivity of the pelvic floor. We're constantly kind of just gripping everything down there. Um, but then on the other hand, you also have a hypotonic, and that is just a little bit more weak, uncoordinated. Muscles aren't really firing like they need to. They're just a little bit underactive. And that can be because other muscles are overactive. Like maybe your glutes are overactive, your core is overactive, like, and your pelvic floor is like, well, I don't really need to do anything. So what do I need to do here? Right? So it kind of just depends on the person's lifestyle. What do they do day in and day out? How do they stand? What are their habits? And then, from there, it's just based on like symptoms because symptoms can show up either way. You can have a hypertonic or a hypotonic, and you can still have the same symptoms in front of you. You can have pelvic pain with a hypertonic or a hypotonic. You can have leakage with a tight pelvic floor or a weak pelvic floor, uncoordinated pelvic floor. So I don't really like to put people in baskets of like, okay, symptoms. Okay, because you have leakage, you have a tight pelvic floor. That's not always the case. So some people think that when they have leakage, it automatically means that their pelvic floor is weak, uncoordinated, and hypotonic. It means that it's not working. Like she's just weak down there. You better do your Kegels, right? Like a lot of people think that. And that's actually far from truth. A lot of women with tight pelvic floors actually have leakage more than people with like just weak and uncoordinated pelvic floors. Because be in mind that hypertonic, tight, also means weak and uncoordinated. Tight muscles are weak muscles. So it doesn't matter if someone's overactive or underactive. We just need to find the frickin' middle and get them to be active and contract and relax when they need to contract and relax. That's really what it comes down to. So I
Mm.
don't really like the descriptions of that. It only matters for a provider. It doesn't matter to you as a patient. You just need to do what you need to do to get them to down regulate or up regulate. That's really all it comes down to.
Mm. And when it comes to some of those kind of sort of simple lifestyle practices that can support, a healthy, balanced pelvic floor, what should we be aiming for?
Yeah, so I have a whole like habit challenge in like one of my communities on this because like there's so many habits out there that are like, "Oh my gosh, so basically I breathe wrong and I and I have pelvic floor issues." People are like, "I don't do anything right." Because there's so many. And that's the thing. It's like I could list all of the things you're probably going to be like, "Yep, I do that. Yep, I do that. I do that." But it's like I do all of those things and I don't have pelvic floor issues, right? So I'll list a few. Posture is a big one. And there's not a lot of research, I will say. There's not a lot of research behind these things. So we're not talking in absolutes here. Like it's not like, oh, if you stand this way, you have pelvic floor issues or you're going to have pelvic floor issues. It's more so like patterns. When I work with women who have pelvic floor issues, these are the patterns they demonstrate. When I fix the patterns, the symptoms go away. Okay, so that's where I'm speaking from. So posture, sitting, standing posture. So ribs over hips. So that's a big one. We need the ribs to be positioned nicely over the hips. Meaning if you have a sway back posture where you're kind of like in a position where hips come far really forward, chest kind of like sinks in, or the opposite where you're kind of like pelvic dumping and then your like chest is really flared and the ribs are flared, right? So like if there's a kyphotic posture or a sway back posture, whatever you want to kind of call it. And that position, it tends to be favored like postpartum, holding babies or during pregnancy. And people maintain that posture for longer than they need to, especially like if they got it during pregnancy, baby sat really high in the ribs. And now that posture kind of like just like flows into postpartum because your body takes the path of least resistance, always. It always does. It's lazy, inherently lazy. And so those postures need to be corrected postpartum because yes, you might not have issues right away postpartum, but like a year from now, you might, 6 months from now, you might. And that's the biggest thing is like people don't realize that small things just like that can actually lead to long-term dysfunction, even though it's so small. So like rib flaring, right? Postural deviations like that. Like I already mentioned, glute gripping all the time, ab gripping all the time, wearing tight clothing. Wearing tight clothing makes you ab grip and glute grip a lot because you're like, it's uncomfortable. Like it makes you kind of like suck in. Otherwise, you're like I don't know, think of like cinnamon rolls, like you got like digs in your skin and it's not comfortable. So you're more likely to tuck in or suck in when you're wearing tight clothing. Other patterns would be like constipation. So like if you're chronically constipated, you're probably more likely to strain on the toilet. And overall, straining on the toilet is just a big no-no. Whether it's urination or it's bowel movements, frequency of urination, frequency of bowel movements. If you're constantly going to the restroom, like especially urination, like every 30 minutes, like red flag. We shouldn't be peeing that often. 3 to 6 hours is normal. Urgency to use the restroom. That's a big one where people are like, yeah, I just like I gotta go and I gotta go right now. Habits like peeing just in case. Someone who leaves the house and they're like, well, I better pee just in case. You're never gonna find a restroom. It's like, well, I better pee just in case. Well, it's like, just go to the grocery store, lady. Go to the grocery store, and if you have to pee, use the restroom at the grocery store. So those are some habits that are like, okay, yeah, maybe there's not a ton of evidence behind it, but it's like most women with pelvic floor issues are doing these habits. And I'm like, okay, let's break these habits, try to replace it with a better habit and see how it helps. And oftentimes it does.
Mm. Well, the going to the toilet before you go out is a big one that you kind of get taught as a kid too. Like your parents are always like, go before we go so that you don't need to go while we're in the car, or, it's like a, inconvenience thing as such.
It really is, and that's where it stems from. And I'm like, blame your mama, blame your grandma when you were growing up, because it is an inconvenience for parents. But I don't think parents know the detriment it can actually have on a little kid's bladder as they age. A lot of young girls, especially. And also, too, like it's like there's a stigma around public restrooms being gross. And it's like, okay, come on. Like, in what world? Like most public restrooms are cleaned daily, more than the toilets in your home, let's be honest. And there's actually some research. I read a research article one time that was like the toilets in the public are actually cleaner than the ones in your home. And I'm talking like mainly public. I'm not talking like campgrounds and like like let's not get it twisted. But like for the most part, like sit down on the toilet, use the restroom. It's not that bad. Your pelvic floor will thank you. It's like, do you want pain? Do you want urgency? Do you want frequency? Do you want all these other issues? Or do you just want to sit on the toilet and lay down some toilet paper? So that's my 2 cents though.
But also, I think too, the other thing is sometimes like even just going to the toilet is seen as like an inconvenience. So people try to do it as quick as they can, and they don't sort of take the proper time they need to relax, and go.
Yes, that's another thing, guys. It's called the restroom. You're supposed to rest in there. You're not supposed to push through it. And that's where like we call power peeing or straining for a bowel movement because it is an inconvenience. But it's like it's just education. At this point, it really just comes down to education around what's best. And we're all out here just trying to do our best. So there's not like absolutes, there's not right, wrong. It's very much just like if you're in a hurry, sure. But every time you use the restroom, do you need to be in a hurry? Like, what things can you do to just take note of, be educated, and be like, okay, if I'm straining during every bowel movement, if I'm power peeing every time I pee, that's where I'm like, okay, what can we change here? Where can we figure out why are you rushing every single time? And just try to make better decisions. That's really what it comes down to. So that way your 70-year-old bladder doesn't hate you.
Mm. And also, I think there's maybe a misconception out there. A lot of women believe that we'll only have pelvic floor issues if we have kids. They think, oh, well, I haven't had kids, so my pelvic floor is going to be fine forever, which is not necessarily the case because we do have changes to our pelvic floor as we hit perimenopause and then menopause with estrogen levels changing. So, can you dive into that a little bit around the changes that do happen as we hit those stages of life?
Of course, yeah. And like you're mentioning right away, most people worry about it when they have a kid. And that's not the case for a lot of women, honestly. 1 in 3 women struggle with pelvic floor dysfunction. Not 1 in 3 women have a kid. And so pelvic floor dysfunction doesn't discriminate. Like everybody has it. Kids, I've treated 5-year-olds with pelvic floor issues. I've treated 95-year-olds with pelvic floor issues that have never had kids. So that's a really big thing I don't want to just like skip over is because even men have pelvic floor issues. Like women in general live lifestyles that are opportunistic for pelvic floor issues. And so women who have kids, it's just another risk factor. That's really all it comes down to. And so as we age, we have more risk factors, honestly, and we also get older and our habits catch up to us. That's what I'm saying. I'm like, your 70-year-old bladder is going to hate you when you're doing these 30-year-old things because they do end up catching up to you whether you are postpartum or not and you've never had kids. And so when you do hit like perimenopausal age and menopause, like your pelvic floor does have a harder time bouncing back. It has a harder time gaining strength and elasticity because you lose powerful hormones like your estrogen and progesterone and testosterone that help you build muscle and build like plumpness in your tissue. And so if you're dealing with pelvic floor issues in your 30s, now is a perfect opportunity to get ahead of those issues because it becomes harder as you age. And that's just point blank honest. Like I'm a very honest person in terms of that. And I'm like, not saying you're going to have pelvic floor issues, but if you have issues right now, 20 years from now, you're going to be kicking yourself that you didn't do anything sooner. And I always talk to women in their 50s, in their 60s that I do treat. And they're like, oh man, if someone would have told me when I was 25, I'm like, all right, that's me. I'm telling you now on this podcast, if you're 25 and you're listening, now's the time. So really, it can happen anytime, but now is always a perfect time to get ahead of it.
Mm. And I think too, because I have a lot of clients in their 50s and their 60s, again, that whole education piece, it just, a lot of the time it wasn't there for them either
Mhm.
back after they were having kids and stuff too. And then, maybe they've turned 50 and they've come and found Pilates, and we start just basically on their breathing. And we obviously talk about what their pelvic floor health is to start. And I might refer them off to the pelvic floor physio. And just by starting to connect with their breath, they start to see some changes, and then they learn how to correctly, connect to those muscles and relax those muscles. And they're like, oh, wow, again, if only I'd learnt these things earlier, things might be a little bit different.
Yeah.
But they still see changes
Yeah,
occur with their pelvic floor health, even if they are
absolutely.
working on them, later on.
Yes, absolutely. It just might take a little bit longer and be a little bit more frustrating. That's all it is. But it's never too late. Never. I've worked with literally 80-year-olds and 90-year-olds, and I've taught them how to activate their core and learn to breathe correctly. And they start seeing changes.
Yeah. And I think, again, that's another kind of misconception. I know, when I do have clients come in and they're like, oh, I've had these kind of pelvic floor issues for 20 years. My son's 20 now, my youngest. Is there anything I can do? Can this change? And it's like, yes, it definitely can change, but we have to start doing something about it.
Absolutely. You really do have to start doing something about it because, and that's the thing, it's like these pelvic floor issues, they start really small. Like it's like, oh, I just can't feel my core anymore. Oh, I leak a little bit when I sneeze. And then over time, it's like, yeah, I don't run anymore. I don't jump anymore. I don't do all of these other things because I leak all the time. And it's like, man, if we just started when it starts, that's when you get the biggest bang for your buck and you can see the most amount of change.
Mm.
And preventative medicine is the best medicine.
Well, I think there's definitely sort of mixed messages out there for people, in the sense that I think they think that some leakage as they get older is normal, because you hear and you see the advertisements on TV that say, if you're having leakage, just get these panty liners, and that's going
Mhm.
to prevent any sort of embarrassment as such. And I think that kind of reinforces that these symptoms are normal. And I don't think they can be common, but they're not what should be happening.
Oh, absolutely. And I think too much stuff is normalized. And it's unfortunate. And I think it goes with every profession. It's not only my profession. Like, too many things are normalized anymore. And it's taboo. A lot of people don't want to talk about it. Providers don't give opportunities for patients to talk about it. Um, Patients are embarrassed. They don't talk to their spouses about it. So it's just one of those things where it's like it's internalized. There's shame, there's guilt, there's embarrassment, there's fear. There's so many feelings that come with pain, leakage, symptoms, like, and they don't know where to start. They get confused, they don't know who to talk to, and so they see things out there and that makes them feel less alone when someone else is talking about it on a commercial, on Instagram, on whatever, and they're like, "Oh wait, that's me too," and they feel seen and they feel validated, and then they sit in that discomfort and it becomes comfort because now they're seen and they're validated. And it's a cycle. And it's unfortunate that it is. And it's hard to break that cycle. It's hard to break someone out of their comfort zone of them feeling validated for what they're feeling and then trying to then change their mind that they can change it. Especially after dealing with it for 20 years, like it's really hard to change someone's mind where they're like, "Well, I've been dealing with it for 20 years." And I'm like, "Well, what have you done for 20 years to actually fix it?" Kegels, medication, sat on a chair, did all of these things. And I'm like, well, none of those things actually help. And so, yeah.
Mm. And I think that's where you need to have, good relationships with your healthcare professionals, whether or not it's just maybe you're relying on your local GP or whatever. I think, having people that are very knowledgeable, but a good network of people that you can reach out to can then refer you on to someone that can give you the help as well.
Yes, absolutely. It's having people in your network, honestly. And going back to like being pregnant and postpartum, I think having a birth team is really important. Most people have an OBGYN or a midwife, and like that's it. And so I think having people on your birth team should be normal, where the OBGYN is like pelvic floor PT. And then every new mom out there that, has a newborn gets helped. And this is where we change it for the ongoing generations. And I think that a lot of our kids, millennials kids, are going to be the generation where they have less issues because of social media talking about the prevalence of everything. But also too, like social media is like toxic in its own ways. Like it's like, oh, be careful. Root cause this, root cause that. And then people like get tripped up about everything and they overanalyze everything and then there's still an analysis by paralysis. But I think that it really does come down to just like having a network, having providers you can trust. And this like goes like obviously have a podcast too, and I talk about like rewriting your blueprint. And it's like just because you were told something doesn't mean that that's fact. Ask why. Ask questions. If something doesn't make sense to you, don't run with it. Like just get curious and be like, okay, appreciate your opinion. Let me go see if there's other options, there's other opinions out there, because that's when you really become your own advocate. And when you're your own advocate, you get curious and you can make better decisions for yourself and not just rely on one provider's input or one friend's input or whatever. I think that's so important to have a network of people that you can trust.
Agree. Because also, depending on who you're seeing and going to, say like your local GP, they only know what they know, as in, if they haven't tried Pilates before, then they're not going to suggest to you that this is a good modality, to potentially help you retrain your pelvic floor or see a pelvic floor physio or whatever it may be. So I think the more people that you can have in your network and you can speak to about it, then the more information you can get. But then also you can go out and do your own research as well.
Yeah, exactly. Couldn't agree more.
Now, before we kind of get towards the end, I do want to touch on prolapse because I know, again, that's another one of those sort of taboo areas that women often don't talk about, but it's happening and I think it's great to get that information out there. So,
Absolutely.
can you kind of just talk about maybe what the signs are potentially leading to a prolapse or, and if we have a prolapse, what we can be doing?
Yeah, absolutely. Prolapse is something I'm like really specialist in treating. It's one of those things that I really find transformational for women because prolapse can be so dreadful and like fear-based and like people just like think their lives are over, honestly, with a diagnosis of it. So prolapse itself sounds scarier and feels scarier than like what it really is. Like we think of prolapse in the modern day as like a disc bulge of the low back, but it's like kind of a bulge of the vagina, for lack of better words. And prolapse itself can exist and have no symptoms whatsoever. And then it can exist in the smallest way possible and someone can have a really lot of symptoms. And so the spectrum of symptoms go it's so big. But for the most part, when someone starts to feel like they have prolapse, you might notice symptoms of like heaviness, like a dragging, a bulging, feeling like a tampon's kind of like slipping out a little bit, or like a bubbly sensation, feeling like something's just kind of like stuck. And then some people can also experience pain, like pain with intercourse, resting pelvic pain. And oftentimes those are like the true prolapse signs, but you can also have things like constant need to pee, leakage. Like you can have like a bladder prolapse, for example, like you might show more bladder symptoms than you do like prolapse symptoms, like heaviness and dragging. Like you might be like, oh my God, I can never pee, or I pee all the time, or I can't empty my bladder. Like, and that might point to prolapse. And then you go into your OB or like your urogynecologist, and they're like, oh yeah, like your bladder's prolapse. And then you're like, oh my God, mental spiral. Now you're like, now I have prolapse. It's not my bladder, it's prolapse. And then you're fixated on prolapse, and now you're not worried as much about treating the bladder symptoms. So it looks different for everybody, but the general prolapse symptoms are heaviness, dragging, things like that. But then you also have bowel prolapse, and that might look like just severe constipation, pressure in the rectum, and not necessarily vaginal dragging and bulging and feeling like something's falling out. It might just be constipation. So it looks different. And for the most part, women will often not know they have prolapse until they get checked, which is kind of like a double-edged sword because, yes, now you have a definitive diagnosis, if you will. And again, every provider is different. I don't like diagnosing stages of prolapse. I think it's more medical jargon than anything. For me, it's like, okay, if I have a grade 1 or a grade 3 or a grade 4, like it just catastrophizes it in a patient's mind more than anything. I think it's mostly for providers to know and for um, outcome measures and insurance providers or insurance companies to just kind of see progress. But for the most part, I think when we tell patients that they have like a grade 3 prolapse, it's going to catastrophize everything for them. And that becomes a new label for them. Hi, I'm Courtney. I have a grade 3 prolapse. And it's like, no, we don't need to do that. I think it scares people. I think it fear mongers people. And I think that they then stop living their life. And it's not something that you need to stop living your life over. What you need to learn is what that diagnosis means, what it means to limit you, and how do you work on finding your way around those limitations and busting through those limitations? Because healing is possible. And most people go and get the diagnosis from their doctor. It's the double-edged sword. It's like, okay, yes, I have my diagnosis. I know I have prolapse, but now what do I do? And it's like, oh shit, like now what do I do? And it comes down to like, what is the provider going to give you in that moment to make you feel better? Hey, you have a grade 3 prolapse. Okay, now what? And most of the time, they're not given go to pelvic floor PT. Sometimes they are, and I love that. But sometimes they're not. And it's like, well, stop running, stop lifting, stop doing whatever. Don't lift heavy, don't lift more than 10 pounds. And we'll schedule you for surgery once you're done having kids. And it's like, what? Like, where did we go so far? So again, I am big on symptoms. What are you feeling? What does it feel like at the beginning of the day, the end of the day? What does it feel like when you're exercising? How is it impacting you mentally every day? How are you showing up for yourself? How is it affecting you emotionally with your kids, your family members, your significant other? Do you struggle with intimacy now because of it? I'm really just diving into physical symptoms or physical sensations, emotional toll that they have on their body, and then their mindset and the fear around it. If I can address those things and help them heal, I don't care if it's a grade 2, it's a grade 3, it's a grade 1. That literally doesn't matter to me because I want them to live their life. And when they have that diagnosis, it's just I'm on a rant now. But anyway.
Mm. No, and I get it. I've had, the experience I've had with clients with prolapse, it is sometimes very life-changing and it does get them down a lot. And they do come into me and they're like, oh, I can't do a whole lot because I've got a prolapse. And then they're actually surprised how much we can actually do, even
Yes.
when they do have a prolapse. And then, they leave and they are feeling so much better. And that's where, if they haven't seen a pelvic floor physio, I was always, make sure that they are off to see the pelvic floor physio and, learn about other things they can be doing and get more information
Yeah.
about their own pelvic floor. But I do think in this day and age, for someone to be like diagnosed by their doctor with a prolapse, but then not referred to a pelvic floor physio, it's just wrong.
Why?
Like, we want to
Why?
be avoiding surgery at all costs, if we can have a more conservative management program that actually works, why would we not do that? In all senses, it's better for the patient health, it's better all for the overall healthcare budget, it's win-win across for everyone.
Literally, it's the biggest win. And I think what's like the bad part about it is that the stigma is you can't lift, you can't run, you can't do any of these things anymore. And so that makes women feel like they can't. And so anyone that can help them do those things, they have their walls are up. They're like, "Wait, no, 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 my doctor told me I can't." And it's like, "Okay, take it with a grain of salt." Like that's when it comes back to being your own advocate, asking hard questions to your doctors. Why can't I lift? What is that actually going to do? What research have you read that actually proves that? Because now there's research out there that says, nope, you can still lift and it actually won't cause prolapse. So, like, the biggest thing is becoming your own advocate and standing up for yourself and, like, literally calling BS to your doctor because it's literally going to change your brain. A diagnosis like that and what your doctor, the original diagnosing doctor, is going to change your brain. And that's going to limit you and then limit your belief and your hope and your ability to actually heal because you think that you can't because someone told you that you can't. It's crazy. I can talk about this literally all day.
And again, I think, it's going back to that education, piece. Like, you can go back if you've been diagnosed with a prolapse. Let's go back and look at your breathing patterns. You know what I mean? I think that's where, if you are doing a modality like Pilates or yoga and you are having that connection to your breath and you're learning about your breath, that can really make a huge difference, just in taking those first steps.
Yeah, well, that's what it comes down to is like, well, why did prolapse happen in the first place? Like, let's go there. Let's get to the root of the issue. Prolapse didn't fall out of thin air and is like, I'm going to pick you today. Like, your lifestyle and the things that happened to you led to that. But what is the reason for prolapse? Pressure mismanagement and maybe an injury during birth. There's a lot of risk factors for prolapse. And when it comes down to pressure mismanagement, which is like most of the cases, and independent of like very traumatic birth and pushing for like 20 hours or something like that, pressure mismanagement is your diaphragm doesn't know how to lengthen and your pelvic floor doesn't know how to lengthen and contract. Like it really comes down to mismanagement between your system and in that incoordination. If we can fix the incoordination, your symptoms get better. So education. Yeah. Why did it happen? How can I fix it? How can I move on with my life?
Agree. And as we're kind of getting to the end of our conversation, is there anything that we haven't, touched on or highlighted about the pelvic floor that you really want women to know about?
I think that my biggest thing, obviously, I treat a lot of active women and I treat a lot of prolapse and women that want to get back to higher levels of impact with prolapse. So like running and jumping and things like that. And I strength train. I'm very, very heavy-handed in strength training versus light, gentle movement patterns, which kind of like goes against like Pilates, right? But like you have to do both. You have to do both. Pilates is not the end all be all for strength training. And I think that some women think that that's their destined motion for pelvic floor health. And it's not enough. You need to overload the pelvic floor. And you do so by overloading the glutes, the core, the adductors, the hip flexors, the quads, the hamstrings, literally everything that surrounds the pelvis. You need to overload it and isolatedly overload it. Make sure each one can contract on its own, each muscle group. You feel the activation. You know what your core is doing. You know that how your adductors are supposed to fire. You know how your glutes are supposed to fire on their own. And then you bridge it back into strength training, compound lifting patterns, squats, deadlifts, lunges, RDLs, traditional strength training, because that's how we move through real life. We get in these push-pull patterns all day long, and people aren't strong enough to withhold those patterns. So when you overload it in the gym, your body actually has a chance to heal because all your muscles that are your pelvic floor muscles that have symptoms, whether they're hypo or hypertonic, they're screaming for help. They're like, "Hello, I cannot do this anymore. Strengthen your damn glutes, strengthen your core so I can get a break." when you're having a lot of pelvic floor issues, it really comes back down to the pelvic floor doing jobs that it doesn't need to do. And so if you get everything else around the pelvis like really strong and mobile, your pelvic floor is having a heyday. It can actually do its main functions and not worry about stabilizing the pelvis and worrying about all of these crazy other things. It can just manage pressure and keep you constant. So my biggest piece of advice is to strength train and don't be afraid of it. Don't let a diagnosis hold you back because healing happens when women get strong and mobile, period. Humans were meant to be strong and mobile. We were never meant to be sedentary, foo-foo, hanging out, doing nothing, walking. Like we were meant to be strong. And I think that we've gotten so far away from that. So.
Well, that's amazing because I agree with everything there. Even
Yes.
being a Pilates instructor, I would say I'm different to the norm. In my studio, I've got kettlebells and weights and
Yes.
all those types of things.
You
And
have to.
yeah, we add them into exercises, especially for the women that, my clients I know that are not going to the gym and are not strength training. I encourage it as much as I can, but I also make sure they're getting some of it in class because I know they're not doing it elsewhere. Or for my other people, I at least start to introduce, some of the stuff so that then when they go off to the gym, they're like, yeah, I've held kettlebells before, I've held weights, I know kind of what I'm doing with
Yeah,
squats and lunges and deadlifts. So it gives them that confidence to then bridge across to adding more of that strength training in as well. So,
you have to
yeah,
be bold. You have to.
exactly. And again, as you said, that piece of loading, of adding in that progressive load too, is super important because I think a lot of people just go, "Oh, I can hold 2 kilo weights and that'll be enough." But no, it won't be enough, especially as we get older. We really need to be building up that strength more and more.
Oh my gosh, that's a whole nother podcast as we get older. We have to be lifting, we have to be jumping, we have to be running, like we have to be doing these things.
Yeah. Use it or lose it, pretty much.
Yeah. Yeah.
Amazing. Now, where can our listeners reach out, connect with you, and find out all about the work that you do?
Yeah, so on Instagram is probably like my biggest platform, and TikTok, the female athlete DOC at the end. And I have a ton of free resources like on my website, a lot of downloadable like free guides. I have a 5 biggest mistakes in healthy habits so we talked a lot about habits. Like on my website, I have a lot of habits that are like just sneaky things that like you might not realize. Just over time. Like again, we're not talking, absolutes, just like over time, just things to be mindful of. And then I have a free community as well with a ton of videos, downloadable resources, how to actually activate your core, your pelvic floor, how to breathe, all of those things. So, yeah, my Instagram is probably the best place, the female athlete doc.
Amazing. Well, I'll link that up all in the show notes too. So listeners, head across there, check out those links, and then connect and follow along with Courtney too. But thank you so much for coming on the podcast. As I said before at the start of this kind of episode, I think this is a really important topic and more women really need to know about it.
Of course. Thank you so much for having me.